Well, I think we all know that our community has a lot to be proud of. I mean, there's Shepherd, there's Midwestern, Hotter Than Hell. And I might be slightly biased, but I also think that the health system that's represented by United Regional and others within our community is second to none. Nationally recognized, in fact. But there are some things we can improve in our community, and one of those is our overall health. While United Regional and our hospital and our clinics does, I hope, a great job in taking care of sick care and delivering sick care, one of the things we're working on is delivering a higher degree of health for our community beyond the walls of our hospital and our clinics.
Several years ago, United Regional identified a high-risk population of patients that really were having a difficult time assimilating into the community. They were mainly unassigned or unfunded patients with what we call a lot of comorbid issues: heart failure, sepsis, cancer, diabetes, and they didn't have access to care or had a difficult time getting into the community programs that were available. And so the Transitional Care Clinic is designed to transition patients to that next level of better care. We transition patients from acute care hospital stay, from a nursing home or rehab discharge, transition patients that are from the emergency department that have come through the emergency room with a disease process. They don't have a provider to follow up. We see them and then determine what other resources that we can utilize to help them to improve their care, to finish the treatment plan, and then eventually get them into an ongoing access program where they can have follow-up care established with a primary care provider through community sources like the Community Health Center, and then, as the word says, transition them to that next level.
I've been sleeping under a bridge for 9 months. I developed carcinoma on my nose. But what got me into the emergency room was I developed cellulitis, and it was real bad. I went to the emergency room and they looked at it, and I spent about a month altogether getting IVs to get rid of this, and then 2 surgeries. I still got a little bit to go. And if it wasn't for you people, I probably wouldn't be here right now. I'd probably be 6 foot under. And y'all gave me a reason to live. There's a love that y'all have for what you do and for what you do for people, you know, and I appreciate it more than you'll ever know.
I got bit by brown recluse, and I came up here to the hospital, to the ER, and they tried medicines, and my body is kind of funny and it didn't work that well. I thought I was going to lose my leg, for sure. But everybody worked like a team, and I was over at y'all's clinic the next day. And y'all did an awesome job. They cleaned it, gave me the right medication I needed, worked with it for a long time. It saved my leg.
Through our foundation, we've created something called the Community Care Fund. And what we utilize that fund for is to actually provide some of these supplies for our patients once they leave the hospital, quite frankly, so that we can help them improve their health so they don't return to the hospital. Federal regulations prohibit the hospital for providing those funds for such supplies and services, in particular around Medicare, Medicaid, and TRICARE patients. So our Community Care Fund and the donations that we receive through our Community Care Fund help ensure that we can provide these post-hospital supplies and services for all patients.
It does take a village to take care of these patients, and many of these patients have catastrophic illnesses, not their choosing. They didn't wake up and decide to have cancer or wake up to have a heart attack or have a stroke. and they have to have resources and they have to be cared for. And so philanthropy goes a long way. And I know that this community has been based on giving. In my time here in the last 30 years, we always seem to come up with a way to figure things out and help people out. And I think because of that, we have the programs available, but we need to grow them. We're a highly uninsured population. Texas is the #1 uninsured population in the country, and we need help. And it doesn't take much to do a lot.